So today we're going to show you how to get the rib hump out of a case of functional scoliosis. Hi, Dr. David Kulla here with Synergy Wellness in New York City, here to discuss how to get rid of the hump or the rib hump from scoliosis. Scoliosis is defined as an abnormal lateral curvature of the spine which measures 10 degrees or more. Often the spinal column will create a side-to-side S-shaped curvature when viewed from behind. Some cases worsen with time and can result in serious problems such as a rib cage deformity and chronic back pain. In the worst cases, interference with heart and lung function may also occur. Structural scoliosis, these curves are the result of changes in the alignment of the vertebra that are fixed. Structural curves can be distinguished from functional curves by their associated spinal twisting and appearance when the patient is asked to bend forward. The spinal twisting results in a rib hump, usually on the right side of the thoracic spine or the rib cage. Unlike poor posture, these curves cannot be corrected by learning to stand up straight. Now treatments, there's a lot of new treatments, they can help improve muscle tone around the affected area, thereby reducing the progressiveness of this type of curvature. Although idiopathic scoliosis, which is categorized as an unknown scoliosis, is also often categorized as structural. It may be a mixed type which includes functional and structural scoliosis, an abnormal flattening of the normal sagittal curves when looking at somebody from the side. Now, functional scoliosis, in this type of scoliosis, there are no permanent changes in the shape or structure of the spine. Functional scoliosis develops secondary to another abnormality, usually a problem in the control of the muscles or in the hip or lower extremity, leg or a foot, flat foot or one short leg. The most common cause of functional scoliosis is a leg length discrepancy, which makes the child or adolescent stand unevenly. Uneven leg lengths can be identified by having the person stand with the suspected short leg on a block of wood, a small thin block of wood, with the hips even at the same level. The spine appears straight. But the best, most definitive way to do that is by x-ray and seeing a specialist like myself. Other issues could be neurological issues, muscle spasms, pain and poor posture all cause functional scoliosis. So today we're going to show you how to get the rib hump out of a case of functional scoliosis. Now sometimes you may see, and by the way, we've done a video in the past, really lengthy video on scoliosis. Make sure you check that out. We go over some different stretches and exercises, some Schroth exercises that you can do to strengthen and correct your scoliosis curves. But in our last previous video, she had a left scoliosis right through here. Now there are different types of scoliosis. You can have a lumbar scoliosis and you can have humping or more musculature sticking out on either side of the back. Typically it's the side of the lateral curve. So some of the more common curves are a right thoracic curve or a thoracolumbar curve, meaning it's in the thoracic and the lumbar area right through here. And you'll just have to find where your musculature in the back is raised and on which side, okay? And it's important to know where your scoliosis curves are. That way you could easily figure out where the rib humping is. But you can also find someone to just kind of check your back. And oftentimes some people will have rib humping without bending over, just from sitting, okay? But if you don't see that, you may want to have somebody bend forward and go ahead. You can't do that here because we have the wall here, but you would have somebody stand up, keep their legs straight and knees straight, bend forward, touch their toes, and you would check down the back and see for any humping or musculature in the back that's higher on one side. And then you would mark that with your hand. Now, once you've marked that with your hand, this right here would be the area of somebody with a right thoracolumbar. This is her right side right here. This is her left side. So with a right thoracolumbar curve and a rotation in the spine, we're going to go ahead and make it simple. Instead of buying a bean bag, you're going to take a sandwich, not a sandwich bag, excuse me, a snack bag. So this is half the height of a sandwich bag. You're going to fill it up with rice, and then you're going to just tape the end of it like this, because when you lay on it, you don't want pressure to pop it open. You don't want rice all over your floor. So you're going to do that. We're going to take this. You can use electric tape. That's probably the best. This is gaffer's tape for film and video, but this will work perfectly for what we're trying to do. And then we're going to just place it right over the Ziploc area there. Okay. Now, for somebody that has a really long curve, meaning maybe they're really tall, okay, maybe this is not enough. For her, this is enough to place over the rib humping area. So you're going to find that hump. And again, if you're tall and you have a space from here to say here where the muscles are protruding out, then you would put one here and you could take the other one and put it here. Now let's say this is too long. You could take some of this rice out, as you can see on the top here. But typically, one of these snack bags, if you have just sandwich bags with Ziplocs, just fill it halfway. By the way, it takes 1 cup of rice, exactly. Put 1 cup of rice in the sandwich bag or the snack bag, fold the sandwich bag over and tape it down so it's about 3 fingers tall, okay? And then you're gonna have the patient or the person with scoliosis lay down on their back. So go ahead and swing your legs to the left, lay down. We're gonna keep it right there where the rib hump is. Good. Go ahead, lay back. And then you're gonna bend both knees. And what you're gonna do here is you're gonna make sure that you're taking a deep breath in and exhale. And with each exhalation, you're sinking into the table. Okay, and deep breath in and exhale. And this is beginners. There are more advanced ways of breathing and trying to fill one lung up versus the other and bring it down to the surface. If you get really advanced, you can control your breathing to the point where you can fill your left lung further. So that's this lung. The bag's on the opposite side of her spine. So she would learn to to fill up that left lung more and sink that left side of the spine down into the table. Yeah, and you can also do this while you meditate. It gives you 10-15 minutes of quiet time every day, but it needs to be done daily or at least 5 times a week. I hope this helps. If you have any questions, feel free to comment below, and thanks for tuning in.